Yeah, very good afternoon. I am Dr. Shantanu Gupta from Avlokan Eye Center, and I will be talking about protecting and taking care of your eyesight, especially in these COVID times. So the eyes actually are a very, very important sensory organ. They are the window to the world, and with this vision, we can connect to others. 80% of the memories, remember, are what we see. The World Sight Day is an annual global event which draws attention on blindness and impairment. The objective is to create awareness about eye care, vision blindness, and treatment of various eye conditions. This day is focused on drawing attention to leading causes of blindness or visual impairment like cataract, glaucoma, refractive errors, and other conditions. We are a population of more than 7 billion people, and today approximately 2.2 billion have an unaddressed vision impairment or blindness. So that's a huge number. Amongst these, 1 billion people have visual impairment, which can be avoided. So it has to be addressed. Also, a glaring number is that we need approximately 1,000, beg your pardon, 1 lakh corneal implants. And annually at present, we are only able to do 25,000. So there's a huge gap there, and we need more and more corneal transplants in our country to prevent corneal blindness, or rather treat it. So we need more cornea donors. Now, sight, as you can see in this diagram, is basically a physical thing as compared to vision, which is a sensory experience. So actually the eyes are seeing, that is sight, but what the brain processes and eventually we see is the vision. So what the eye is seeing is an inverted image, if you see the diagram, and what the brain does is processes the inverted image into a final image, which is erect and straight. This is a brief anatomy of the eye. If I can have a pointer here. So this is basically the anatomy of the eye, and this is the cornea, the anterior part, the lens, and the back of the eye, which is the retina. And this is the optic nerve, which takes the conducts the sensory to the brain. Some of the common eye problems that we are facing today include refractive errors like astigmatism, myopia, hyperopia, dry eye conditions, digital eye strain, especially in these COVID times nowadays, allergic conjunctivitis, color blindness, and night blindness. So this diagrammatic representation here shows a condition which is known as myopia, which is a very common refractive error. Herein, the person is able to very clearly see for near, but is not able to see for distance. Hyperopia, it's pretty much the opposite. So in children now, coming to the children child age group, wherein the conditions are slightly different, we have common conditions like lazy eye or amblyopia, droopy lids. These are conditions generally, this condition is generally congenital, that is present since birth, and squint, or commonly known as crossed eyes. Amongst the elderly age group, conditions like presbyopia, cataract, glaucoma, age-related macular degeneration, and diabetic retinopathy are the common conditions affecting this age group. As I said, myopia is one of the common refractive errors that we have in children and need to be corrected. This myopia is basically nearsightedness and usually seen and picked up in childhood. The prescription is basically a minus or concave correction lenses or contact lenses, and so that the child can see well. This is an image seen clearly by a normal person. This is an image seen by a myope. And of course, it gets to this when it's corrected. This is pretty much the opposite, hyperopia, where we need plus lenses to correct it. Now, coming to lazy eye, which is a very common condition amongst the children, lazy eye, which is technically also known as amblyopia, is a childhood condition in which the child's eyesight does not develop as it should in one eye. So the patient will basically focus with the better eye and the other eye going lazy. There are no obvious symptoms here, and it is typically detected when you do a eye examination and you cover one eye and then you pick it up that it is the amblyopic eye is not seeing very well. Here, the early diagnosis is critical so that the treatment is more effective and the child can have a healthy vision for the future. Common treatment that we do for this is patch the good eye so that the lazy eye gets to see after correction of glasses and it gradually gets activated. This is another astigmatism is another condition. It's a refractive condition which is common in children and needs cylindrical glasses to be corrected. So coming to strabismus or squint, this is commonly also known as crossed eyes. This is basically a misalignment of the eyes wherein the one eye is looking straight ahead and the other is looking either upward, downward, left or right. So this is basically because of muscle dysfunction. It could also be seen in patients of farsightedness or other conditions like trauma. So basically the child will be having double blurry vision here and also headaches. The treatment includes eyeglasses to correct the refractive errors, if any, eye exercises, and if not corrected by the above, eye surgery. This is another common condition seen most commonly congenitally in children wherein the eyelid is droopy, and this is known as ptosis, which is generally surgically corrected. Now, this is a totally different condition, corneal ulceration, which is also a very common condition, especially given in our country, which is mostly agricultural based economy, and there are many farmers who are exposed to organic matter, and they are often coming with these conditions. It's more often seen in rural areas of India, also in urban areas, but more in the rural part. The symptoms of this condition includes redness and feeling something in the eye. There could be pus discharge, there could be pain, there could be swollen eyes, or you could see a white spot on the cornea, as you can see in this picture. The most common causes are either bacterial, viral, fungal, or parasitic. So depending upon the cause, we give the antibiotic or an antiviral or antifungal, and most of the cases are dealt medically. If it is not treated medically, then we have to do surgical treatment for this through a corneal transplant. Another condition which we see commonly in our practice is pink eye or conjunctivitis, wherein the eye is congested and red, and small blood vessels appear on the conjunctiva and they become more visible, giving a pink hue to the eye. The eye can also be irritating, and treatments generally the causes are actually some kind of infection or foreign body in the eye. The common practice to touch your eye or it should be avoided here, and you should wash your hands more often, especially in these COVID times. It is advised that you take extra precautions in a pink eye because it could be early symptom of COVID itself. So try and seclude yourself and see an eye surgeon immediately. And depending upon the cause, then we treat the conditions once you are in the care of an eye surgeon, which could include antibiotics and other treatment options. So coming to this next condition, which is cataract, it's one of the most common causes of treatable blindness, as we all know, and it is because of the clouding of the normal lens of the eye. So this is the normal vision on the right, if you could see, and a person with cataract would be seeing something like this. So it's all cloudy. The symptoms, as I said, are cloudiness, halos around lights, problems seeing in the night. There could be faded view of colors. Also, the patients very commonly come with frequent changes in their glasses number and contact lenses prescriptions. The causes could be multiple. Most cases actually are age-related, but other causes, specific causes could include eye surgery, obesity, hypertension, high alcohol consumption, exposure to UV light, and also poor nutrition and smoking can also cause an increased risk of cataracts. So as I was talking, this is basically the cloudy lens or the cataract which we are treating. So when do we treat it? Basically, when the vision becomes too blurred or the patient is unable to carry on with his routine activities like driving and other daily chores. So then that's when we decide to operate. And what we do is basically a cataract surgery wherein a phacoemulsification of the lens is done, and eventually we implant a intraocular lens implant on an artificial lens to replace the original lens. So this is a good diagrammatic representation of to just to understand what is going on in the treatment part of cataract. So as I was saying, this is the eye surgery which is going on in the right eye, and basically I've talked about this already. Another common condition which is prevalent in the mostly in the adult age group, but also in the childhood age group is glaucoma, or commonly known as kala motia, which causes optic nerve damage. And this is significant because it is irreversible damage. Cataract, whatever vision is lost is retrievable, or to say reversible. But in glaucoma, whatever is lost is lost. So this is an irreversible loss of vision, and so it becomes all the more serious. Why it happens is because of the high buildup of the intraocular pressure in the eye. We have a normal pressure of about 15 to 20 millimeters of mercury in the eye. When this pressure builds up, it presses on the optic nerve and leads to optic neuropathy. And as a result, glaucoma sets in. So it is also known as the silent thief of sight, because the patient has no symptoms. So all the more reason for a routine checkup of the eye with an eye surgeon after the age of 35 to pick up these conditions like glaucoma. So this is, if you can see in this picture, this is normal vision. This is early glaucoma, wherein the field of vision is gradually diminishing. It comes to this, and eventually it becomes a tunnel vision if it is left undetected and untreated. This is what on the right bottom is what a glaucoma patient would see when the disease has progressed and there has been no treatment for it. So what an eye surgeon does tonometry and measures the pressure, sees the angles which drains the aqueous fluid, and we detect also visual field changes using a perimetry machine. The treatment, as I said, is basically eye drops which lower the intraocular pressure and prevents further damage to the eye. There is also laser therapy for this, wherein the laser is targeted at the trabecular meshwork and it leads to increased outflow, thereby decreasing the requirement of eye drops. Also, filtration surgery can be done for this, wherein there is an extra pathway which is made for the drainage of the aqueous outside and resulting in very good low pressures for the eye. Also, other techniques are drainage tubes, and now we have the minimally invasive glaucoma surgery, which requires less post-operative care and has a lesser risk than trabeculectomy, the conventional trabeculectomy. Okay, coming to this is a very common condition also in the aged group, wherein the retina is affected. It is known as age-related macular degeneration. This is the fourth common cause of blindness, and the people who are suffering from this find it hard to recognize faces, drive, read, or perform other activities of daily life. Typically happens in older people, of course. Risk factors being heredity, smoking, and obesity. So this is the affected eye, wherein it is showing changes at the back of the eye or the retina. This is a normal looking macula. This is a dry ARMD and this is a wet ARMD. There are two types of AMDs, dry and wet. So this is generally diagnosed with the help of an OCT and angiogram. The treatment for dry AMD is basically you have no treatment for this. For the wet part, there are injections available, and also lasers are used to treat this. Again, a very important condition, diabetic retinopathy. This is seen in diabetic patients who affecting the retina. and it is caused by damage to the blood vessels of the light sensitive area or the retina. And at first it may cause no symptoms, but or only mild symptoms, but eventually it can cause blindness if left undetected and untreated. This condition can develop in anyone who has type 1 or type 2 diabetes. The longer you have diabetes and the less controlled blood sugar you have, the more likely are you to have this condition. The symptoms for diabetic retinopathy include spots, blurred vision, fluctuating vision, impaired color vision, and dark or empty areas in your vision. As I said, the biggest risk factor is the duration of the diabetes. That is how long you've had this diabetes for how many years. Poor control, of course, will worsen it. High blood pressure, high cholesterol, and tobacco use further cause aggravation of the condition. So the treatment is to prevent the progression by combining it, of course, with good glycemic control and laser treatment. Nowadays, a very common condition because of the digital devices that we are using more often in this COVID times is eye strain. This eye strain basically is a group of symptoms which occurs in people after extended use of the eyes. This can be very, very disturbing for the people who are affected with it. Although it does not lead to any significant damage, but because of the excessive use of computers and all these online platforms that we have to work with, the one we are using right now, it can be pretty annoying. In some cases, the signs and symptoms are maybe an underlying condition, could be an underlying condition that has to be seen by an eye surgeon. Although you may not be able to change the nature of your job, but other factors and some tips I shall be sharing with you in the coming slides. So how do you pick this up? First, you could have eye irritation, you could have stinging, burning, you could have watery eyes, you could have an intense headache or a feeling of disorientation. That could be the initial symptoms of eye strain. So now all these devices have been, we've been using these devices very commonly in the COVID times, and all these social media platforms, TV and everything, they're all screens. So this is a special situation that we are in these nowadays, and we have to deal with that. So some of the tips that I was talking about earlier are to follow, very important, is to start with, make sure that you are practicing a good distance from your screen, at least 25 inches from your laptop or your desktop or any other screen that you're working on. Lower the brightness of the screen. Remember this rule, 20-20-20 rule, wherein every 20 minutes you have to look away at 20 feet for 20 seconds so that you take your eyes off the screen and give your time for your muscles to relax. And also in nighttime, you minimize and set your devices to nighttime mode. Also consider turning off some of the overhead lights that you're working in your room, and try to blink more often. Whenever you blink, it is like a refresh button to the eye and your tear film is rejuvenated. So practice doing that. Also, remember to have good water intake and good sleep. So these are all healthy eye tips to prevent digital eye strain. So the need for regular eye checkups obviously cannot be overemphasized, and it is very important for all age groups to pick up common conditions, and we can always help you if you come to us in time. Also, as I highlighted earlier in my slide, that we are very short on corneal transplants in our country. So I would urge all of you to pledge to donate your eyes. And you can do so by going on this website of the Eye Banking Association of India, and you can pledge there. I have, you should also. Thank you.